All right, well, I think everybody knows me, and I tell you what this is about, really. I left my office one day at 12 o'clock up in Old Keens, where I've been practicing, and I had a dance lesson that afternoon. At 12:15, I woke up, just hit the embankment on the east side of the road. I was going south, and I hit the embankment, just missed a telephone pole in a tree, and wound up in this plowed field. And so I wound up getting out of there. I had a Mercedes at that time. Fortunately, I had to fix a flat on it, and I could drive it back, drive to Oklahoma City in that sucker. This old boy I took it to, he said, "I can't believe you could drive that thing in there." And everybody looking at me when they come back. But I mean, survived it. And I thought, well, I'm burning the candle at both ends. I mean, figure out what's going on. I had no clue. So what happened is, when Angie and I became regular bed partners, she was all the time hitting me in the ribs. This is the truth now. And I hear people talk about that. Give me that all the time. So what's going on? She said, "You're making terrible sounds and you're snoring and you're gasping, breathing like that." So I said, okay. I mean, I was tired of getting, and so I went to the doctor. And they gave me some questions and sent me to a sleep lab. And I wound up getting an oral appliance to, correct my snoring and the other breathing problems I had. And that had been it was in 2010. And I've been wearing that for all this time. And I've had different ones, but started out. So I owe it to Angie. I mean, you're here because of Angie. I don't know what would happen and we not started sleeping together, and she started hitting me. Now, she's my wife, so most of you know that, but I mean, so it's not, I made it legal on that deal. But anyway, well, here's what I think the questions that I had to answer myself, and I think that's what, as individuals, do you have the signs and symptoms of a sleep-related breathing disorder? This is a little bigger word, 4 of them, of course, but sleep-related breathing disorders, there's lots of them. Kids have them, adults have them. I mean, there's all kinds of breathing disorders that happen in the sleep. And then you want to know how serious it is. What's the serious, and can you take care of it? That's exactly what that's kind of what I went through. I didn't actually have those words in my mind, but that's exactly what happened. So here's what it is. There's all kinds of them. We're really here at Snore and Sleep Solutions. We only really deal with the two, the snoring and the obstructive sleep apnea. Snoring's probably the most common thing that occurs outside. Hello, Scott. And that occurs outside, in the environment. It's just that snoring. Small kids snore, adults, older people snore, and some don't, but there's a large percentage of the population that has some snoring. And obstructive sleep apnea is a condition that's diagnosable. Now, snoring is diagnosable by your partner, your bed partner. So you got a snore meter, and there's other ways you can diagnose snoring, obviously. You yourself are not a reliable witness to your snoring. I mean, I asked a guy the other day, I said, "Do you snore?" He said, "I stayed up all night the other night and never caught myself doing it." Here's what happens in airway problems. This would be normal, where that fluid comes through your nose, and incidentally, nose breathing is so much better than mouth. If you got young kids or grandkids, something like that, try and get situated where they're breathing through the nose and practice it. You can teach yourself to breathe through the nose. Now, there can be problems with that. It's where you can't get air through your nose. When you have partial obstruction, that seems like when snoring occurs. As this airway closes a little bit, then there's less air going through there, and those tissues vibrate. And anything, a whistle works that. Same amount of air through a smaller hole makes some noise. Then when it closes off, that would be obstruction. This is the muscles of the tongue. So when they close off that airway, that's when you stop breathing. And then you gasp, and your body's telling you, "Hey, let's take a breath." Take a breath. And it's amazing. That can happen by testing. That can happen 50, 60, 100 times an hour, that you're getting a respiratory deal. So the symptoms is you might be aware of. I mean, there again, you may not know that you choke or gasp. Your bed partner might. You may not know if you have restless legs. Most guys know when this happens, and when they're doing it. So these are things that happen, and sometimes we just attribute them to just being normal stuff. I mean, they could always say, "Well, I'm getting a little older, so well, my hormones changing." It's, you guys tell me, say, "Well, it's just age." something like that, but it can be something else. And so these are symptoms that we try and identify and that you may have, and understand what can be the consequences of it. See, people even with CPAPs, we see quite a number of folks that have already been diagnosed, been treated, and are having challenges with their CPAP, which is absolutely the best way in the world to keep that airway open. There's nothing wrong with that. Just the challenges, and yet we're seeing people there's some combination therapy where you do an oral appliance with a CPAP that can make a difference. We're seeing some stuff on that. One of the main things is just having something on there for some challenges with that. So 2015, the American Academy of Sleep Medicine, which is a doctor, an MD organization, did say and certified that oral appliances, CPAP, first line treatment for obstructive sleep apnea. How common is it? Well, 42 million have some type of it, and about 1 in 5 has some mild, at least mild, and even on up to more severe. And the challenge is that there's a lot of it undiagnosed and untreated, just because it just doesn't seem bad enough. The thing I think about is like, well, I kind of worked with pesticides, and I sprayed and didn't cover myself or anything like that. The pesticide won't kill you. It's the cancer it causes that'll kill you. So the snoring, some of those symptoms, they're not going to kill you. It's what it does to your body that's going to kill you. And so that's what we talk about. Here is a published report on some things that obstructive sleep apnea seem to be associated with in a large amount of cases. I mean, congestive heart failure, hypertension. We're just seeing that, and it progresses. It seems like that's one of the real cues that something's going on. The clues is if they've taken 2 or 3 blood pressure pills, it's progressing. And so it's that's the challenge. You see it start slow and just get worse. Do that. How many people know of somebody that had a heart attack in the middle of the night, 2 or 3 o'clock in the morning? They ought to have it out there pushing their car out of the snow or shoveling the snow, but then they're in bed and they die. They sleep like that. So anyway, what we do is we like to think it's just like checking that oil. When I was a kid, in the tractors we ran, they leaked oil and used it. And every time before we started, I had to stick it in there and pull it out and see where I'm at. If it was down a little bit, I put some in. And I've often thought, I told Dad, I said, well, we could wait till it get down to here. He said, you know what can happen? I said, no, I don't have any. He said, we can ruin that tractor. I said, oh, I see. One time we ran one without my fault too, and it was a bad deal. I was in a big hurry. So anyway, I think the reason I got that is I think it's the place you can get your oil checked, from the standpoint of breathing and stuff like that. So just sometimes some questionnaire, just some different things, kind of identify what problem you might have, something like that. That's a consultation. Included in that, we like to measure the airway and see what's happening with your nose, if it'll, and I'll show you that, what it looks like in the pharynx, how it's doing, if it's closing when you don't have air going through there. And this service, we're just doing complimentary. We just think it's that important to get people in here, and then they can determine what they're going to do. If there's positivities, if there's some positive indications here, then a sleep study, and we recommend a home sleep study, which we have them. We'll have them here where you can do those, or you can go to a lab sleep studies. There's nothing wrong with those. Those are good. You're in an environment differently than your own home. A home sleep study, of course, is at your house. So what we do is test the nose, and this is by acoustical pharyngometers in that front room. You may have seen that, and this bounces through one nostril and the other to see if there's patency in that airway, if something gets through there. If it's not, it'll show down below. There's a degree, and it shows where it's at and those kind of things. So that's what a rhinometer does. And then the pharyngometer tests the pharynx. And this would be when there's breathe. You breathe air, and it'll bounce that sound through there. And then you just stop breathing and see if it collapses. And that's where you get that. Doesn't happen during the day, happens at night. After about 18 vodkas. Or no, you don't have to have that many. I mean, there are things that cause it to collapse more too, But it'll do that a lot, And then, of course, that's what a home sleep study or a lab study will do. In the home sleep studies, there's two kinds that are the most accepted. One is, on the wrist and the finger. The finger checks the oxygen flow, and then this is on your chest, kind of the respiration stuff like that. The other one's an Aries that, and both of them have a deal to tell where you're at on your right side, you're on your left side, or you're on your back. Positional apnea is a real challenge. People sleep on their back, and they'll tell you the same thing. I have patients I say, no, I don't sleep on my back at all, and we'll run this home sleep study, and it'll be 88% of the time they're on their back, which that just lets that jaw go back. It just increases that. So something to hold that forward. That's how oral appliances work. Without, if you're on your back and you have nothing else going on, that tongue and that muscle can go back there, and if it's collapsible, it'll go back there and want to close that, partially or fully. And the appliance is like CPR. It's pulling that jaw forward. Now, there's other ways of achieving that. You can have surgery, and there's all kinds of unique things that are occurring in terms of how people are trying to correct that. Here's what an oral appliance does. Does it work? That's what you want to know. Can you make it happen? Here's a fellow, 38, and came in. His wife made him appointment. She said, I couldn't stand it. And he said that the guys he sleeps with, he goes 2 weeks out on the oil field and comes back in. He said, they're getting kind of tired of me too. So this is a Snore Lab. You can get an app you can put on your phone. It's called Snore Lab. And we told him to pick that up. He ran this without any appliance in there. We made him appliance, and here was a reduction in just snoring. It's a great self-monitoring thing. I tell women to use that sometimes because their husbands don't think they snore. So just do it. Here's his home sleep study. We're about halfway through getting it. We put this in the 23rd. We ran it 22nd, 23rd of October when we first saw him, and then in the 20th of December we got these readings. So this AHI has to do, with the apnea effect, and that's in an hour. This is the respiratory events he had in an hour, trying to, get himself to breathe, set himself up. And down here's, what we got a month later. We think he's still sleeping on his back. I tried to get him one of those slum bumps or something, so we'd have, I think, better success. It shows, because it says positional. That means it's worse when he's on his back. And so down here, it's still positional. But anyway, he went from severe to moderate. This is right above the level of severe, and this is just above the mild. 15 is the mild. So we made drastic improvement in him. His wife's happier, and so the guys in the oil field, he feels better. I mean, he's starting to feel better. It takes a while, he didn't get that inflammation and that stuff going on pretty quick. So anyway, the next step is I'll let Hannah tell you about what happens if you guys want to take another step, and that's what we're here for. We're here to check your oil and see where you're at, and see if it's a quart or if you need, we hope there's no overhauls. There are other solutions than an oral appliance, but that's what we're about. But we're also about trying to help people get diagnosed and understand some options they can have, and so that's what I think. We don't want to have anybody untreated, really. If we can do it, and if we can treat them, it'd be great. If we can't, we'll send you where you can.